Good morning. My name is Angela Wood, and I am the COO at Family and Medical Counseling Service, Inc. Family and Medical Counseling Service, Inc. is a nonprofit, federally qualified health center founded in 1976 that provides a full range of primary medical care, behavioral health, support services to children and adults in Washington, D.C. and Prince George's County, Maryland. We also provide comprehensive harm reduction services to residents in Washington, D.C. and Prince George's County. Our harm reduction programs include syringe exchange, distribution of naloxone or Narcan, fentanyl test strip distribution, wound care, access to medication-assisted treatment, which for us is primarily Suboxone, HIV counseling and testing, hepatitis screening, referrals to primary care, substance use treatment, and mental health. The addition of the harm reduction vending machines to our program is another opportunity to provide DC residents with access to Narcan and other health and wellness products. Specifically, the harm reduction vending machines will provide access to Narcan, fentanyl test strips, personal biohazard disposable containers, hygiene kits, wound care kits, COVID test kits, male and female condoms, and later during implementation, HIV home test kits. The machines will be open to the public on April the 10th, 2023. Residents will be able to walk up to our machines and call the number on the machine to gain a one-time access code and to dispense needed materials. They will also receive instructions on how to complete a brief registration for ongoing access to the machines. Existing participants in our harm reduction programs and substance use treatment programs will be registered for the program by our outreach team. Finally, we will have outreach workers in our mobile units to offer registration more broadly to DC residents. Registered participants will receive an access card, such as this, to be able to dispense items from the machine. Currently, all of our harm reduction vending machines are located in fire stations in areas of the city that have been impacted by the opioid crisis. Here at Half Street Southwest, on Minnesota Avenue in Northeast, and Atlantic Street in Southeast. We feel that this collaboration with DC Fire and EMS is an excellent example of a public-private partnership. The pilot project, if successful, is scalable, has the potential to be expanded to other firehouses across the city where residents are being impacted by the opioid crisis. The pilot project would not be possible without the funding and support of the DC Department of Health, and we are excited to continue that partnership to keep the residents safe. Mayor Bowser and the administrators and staff at the DC Department of Health and the HIV/AIDS, Hepatitis, STD, TB Administration, HOSTA, have done an excellent job of providing a space for innovation and creative programming to keep DC residents safe. Please welcome Dr. Lewis, the Interim Director of DC Health, who will further discuss this project.
Good morning, and thank you, Ms. Wood, for that warm welcome. I am excited to be here today on day 2 of Mayor Bowser's Back to Basics Week, and to highlight how partnerships with community-based organizations such as Family and Medical Counseling Services, FMCS, help us at DC Health and other district agencies to provide invaluable services and resources for district residents. In addition to partnering with FMCS, DC Health has partnered with another community-based organization honoring individual power and strength, HIPS, on providing 3 additional harm reduction vending machines for a total of 6 in the community. One of the HIPS vending machines is placed at the Whitman Walker Health Site on Martin Luther King Avenue, and we are working to determine 2 additional locations. As Ms. Wood mentioned, The vending machines will provide residents with 24/7 access to free disease prevention supplies to empower residents to take charge of their own health, regardless of their status or living conditions. The machines will be equipped with a variety of items, from hygiene kits to life-saving Narcan administration kits. They will be strategically placed in areas that are not well resourced and areas where residents are impacted by the opioid crises. DC Health is committed to safeguarding the health of all DC residents regardless of their social economic status. The harm reduction vending machine pilot program will be critical in helping us achieve this. Harm reduction is a proven effective strategy to help individuals reduce their risk of harm from diseases, and these machines have become prevalent in multiple cities to provide low barrier access to the most vulnerable populations. This pilot is geared towards evaluating the utilization patterns and positive impact these products may have on the well-being of vulnerable communities, such as the unhoused or people at risk for opioid overdose. Now, I'm excited to welcome Dr. Barbara Bazran, the Department of Behavioral Health Director, to the mic to talk a little more about the importance of increasing access to life-saving products like Narcan and fentanyl test strips in areas impacted by opioid overdoses. Dr. Bazran.
Thank you very much. I am really delighted to be here today to join our partners to get the word out about naloxone. We work together every day to prevent opioid overdose deaths. Opioid overdose deaths are preventable. Last year, more than 2,600 overdoses were reversed. I am proud to say that our community has joined together in record numbers to make naloxone easy to get in pharmacies, community sites, public schools, and in our homes. It's free. No ID or prescription required. DC is a national leader in naloxone distribution, and each year the number of kits distributed goes up. In the 4 years since we started our Live Long DC campaign to address the opioid epidemic, more than 130 government and community partners have distributed over 156,000 naloxone kits. I want to take a moment to recognize Chief Conley from Fire and EMS, who was a leader in using naloxone before the start of the Live Long DC campaign. Naloxone is easy to get and is an easy to use nasal spray. And it comes in this box, which you will see right behind me in the vending machine. We have one goal. All of us here have one goal, and that's to keep people alive with the possibility of treatment and recovery. If you know someone who is struggling with addiction, get and keep naloxone. The chief medical examiner reports that 66% of overdose deaths occur in the person's home and 22% in the homes of family or friends. This is important to note. Overdose deaths continue to rise within the district, but at a slower rate. 448 of our neighbors died last year. One death is a death too many. We know that fentanyl is the killer. Along with naloxone, we are distributing fentanyl test strips, which you can see here, to warn unsuspected users of the presence of the deadly synthetic opioid. This will warn unsuspecting users of the presence presence of the deadly synthetic opioid. Last year, we distributed more than 1,400 fentanyl test strips. They can be used to determine if fentanyl is in the person's drug supply. The test strips work very similarly to the COVID tests that we have all become familiar with using. The new harm reduction vending machine is another way to make sure that residents have easy access to naloxone while they also get the other resources they need. Along with our partners, DBH offers training on how to administer naloxone and steps on how to care for an individual after the administration of naloxone. Please note, an overdose is a health emergency. If you see someone experiencing an overdose, you can use naloxone to revise them, but first call 911. Then lay the person on their side, tilt their head back, hold their neck firmly, and insert the nozzle into one nostril and press the plunger firmly. Watch the person closely. If the person does not respond to voice or touch, apply another dose. We hope you never need it, but we encourage everyone to get naloxone. Be ready and stay ready to save the life of a loved one, a friend, a neighbor, or even a stranger. Anyone can text Live Long DC to 888-811 or visit one of the new harm reduction vending machines. Get and keep naloxone with you. I have it in my car, in my home, and in my handbag and my office. Be ready to save a life. Thank you very much for having me here today, and I would now like to present our Chief Conley.
Good morning, everyone. Welcome to Engine 7. I'm John Donnelly, Chief of DC Fire and EMS. I'd like to say we're here today as partners I'm here. We need to push that back up. Is that what it is? Okay. I'm here today as a partner to help make our community safer. Noxalone or Narcan is something we've used in the fire service for over 35 years as a response tool. It has saved lives. We've watched it save lives, and it is completely appropriate that this is something that should be available to our citizens every day. We hope that initiatives like this help it get out into the community. I'd like to reiterate what Dr. Bazaran said. If somebody's overdosing, though, call 911. Let us come help you. This is for all those other times. You can think of it as a fire extinguisher. We try to prevent fire, right? And if a fire starts, we teach people to use a fire extinguisher to put it out. Well, we try to prevent opioid overdoses, but if somebody does, the Narcan's a version of a fire extinguisher to deal with that. So with that, I'd like to turn this back over to Dr. Lewis for question and answers and say thank you all for coming today. Let's save some lives.
On behalf of Mayor Muriel Bowser, I would like to thank you for joining us today. We will now open the floor for questions from the press.
You said there were, thank Dr. Bazaran, you said there were 448, I think, oh, there we go. 448 deaths in 2022 due to this. What's the situation like now? I mean, is it worse, improving?
Currently, what we're seeing is a slowing, about a 2% slowing of the number of deaths. But as I said before, one death is a death too many. And harm reduction processes like the use of Narcan and fentanyl test strips is really essential. We gotta keep people alive so that we can get them into recovery. And these harm reduction methods work, and they will make a difference, and it will allow us to reduce the death rate.
And so these machines are going to be, I understand, in 2 or 3 firehouses. Is it Okay.
Currently, the machines are in 3 firehouses. This one here.
So how does that work? I mean, do they just most firehouses a lot of times well, sometimes they're open, but sometimes they're locked up. You know, I mean, how does that work?
All the machines are located outside of the
out-
firehouse, as you can see, and they've been outfitted to withstand temperature fluctuations and that sort of thing so that they can be accessed all year. So this model really gives us 24-hour access to Narcan and other health and wellness, even if the fire department is closed.
So they're all going to be outside.
All of the machines that Family and Medical Counseling Service is hosting will be outside.
And I understand there's one at the Whitman Walker Clinic.
That's not my machine.
Yes. HIPS has one at the Whitman Walker site that is also going to be located outside.
Okay, so people
That's
can just
on Martin Luther King Avenue.
right. So people can just walk up and they don't have to talk to anybody or just.
That is correct. And there's instructions on the front of the vending machine. Would you like to speak to that?
So you do have to, if you're not known to us. So if you're known to us in our harm reduction program or in our substance use treatment programs, we'll register you and give you a card to be able to access the machine. If you are just from general public, you can walk up to the machine. You can call our phone number and follow a prompt that will immediately issue a code that you can use to vend out of the machine.
Hi there. Can you explain how you decided what items should go in the vending machine and if syringes were considered?
Syringes were considered. We decided not to. We do a pretty large-scale syringe exchange program, and much of my team that's on that project is here. We do that mobily across the city, and this is one of our units. So we felt that we were getting the syringes out, but that the more important piece right now was getting Narcan out to help to prevent the overdoses. So we opted against syringes in any of the machines that we host.
And perhaps someone from the city, is this grant funded or how are you paying for the machines?
It's grant funded.
Yes. Yes, it is grant funded, and we were able to support our community, our CBOs, with that effort. First, of course, with purchasing the vending machines, and then, of course, support for the supplies.
How much?
So it was $150,000 that was initially given
For all 4 machines?
for to each of the CBOs. Yes. So $150,000 each. Yes. $50,000 was the cost for the initial cost for the vending machine.
So that represents $50,000. Is that what you're saying?
Yes, because remember this.
Well, I'm sorry, that represents about $13,000 per machine. So we were able to purchase 3 machines for that $50,000 cost.
The contents?
And the contents, much of which are given to us through our collaboration with the Department of Behavioral Health. So we don't have to purchase the Narcan. We do purchase the fentanyl test strips, but we're given some of the condoms and other materials that are in there. So it's a combination of things that we purchase out of the grant, but also things that are given to us through our partnership with DC Health.
So basically $300,000 total for everything. Is that correct?
For the 2 organizations combined.
Right. Okay. Thank you.
Any other questions? Okay. Well, thank you very much for today. Thank you for joining us. Thank you. Oh, there's one more question? Okay. Thank you very much.